Gillibrand, Democrats deliver resources to bolster public health, aid economic recovery and boost essential services to combat pandemic and deliver relief to workers and families, and cash-strapped state and local governments. Washington, D.C., aided by aggressive action by U.S. Senator Kirsten Gillibrand, the Senate today passed the American Rescue Plan to support American families and small businesses, and deliver critical resources for public health, health care, economic recovery and essential services. Gillibrand successfully negotiated the inclusion of several provisions in the relief package. She authored legislation to create a health force to aid vaccine distribution and deliver funding for cash-strapped state and local governments, and pushed for the inclusion of legislation that will strengthen small businesses, reopen schools, renew emergency paid leave provisions, and help families weather the ongoing economic crisis. The American Rescue Plan delivers comprehensive and robust relief to New York families. I'm proud it will provide more resources to New York's healthcare system, workers, small businesses and families facing financial strain due to the public health and economic crisis, said Senator Gillibrand. I'm particularly proud that this bill includes a nearly $8 billion down payment for Health Force, my legislation to create a robust public health workforce to strengthen vaccination efforts. My colleagues and I fought hard to support our frontline workers, strengthen vaccine rollout, help our schools safely reopen, bolster small businesses, and provide relief to the millions of Americans struggling to make ends meet. While there's more work to be done to help America fully recover, this bill is a huge step to further address this crisis, and I will continue working with my colleagues to help rebuild our economy. The following priorities for New Yorkers in the American Rescue Plan: $7.66 billion for a new public health workforce based on her landmark Health Force legislation to expand the nation's public health jobs and infrastructure and aid the country's vaccine distribution campaign. Grants will be awarded to state, local, and territorial health departments in order to recruit, hire, and train individuals to prevent and respond to future public health emergencies, and respond to ongoing and future public health and health care needs. Senator Gillibrand authored the Health Force, Resilience Force, and Jobs to Fight COVID-19 Act, reintroduced it this year and has championed the proposal throughout the pandemic. Expansion of federal emergency paid leave and paid leave tax credits. The American Rescue Plan provides $570 million in additional funding to support an additional 15 weeks of paid leave at $1,400 per week to all federal workers, including USPS employees, for COVID-19 related reasons for themselves and their families through September 2021.